Okay, this is Chapter 13, Blended Competencies, Clinical Reasoning, and Processes of Person-Centered Care. Through this chapter, you should learn how to describe each element of the thoughtful person-centered practice, the nurse's personal attributes, knowledge base, blended QSEN competencies, clinical reasoning, judgment and decision-making, person-centered nursing process, reflective practice, leading to personal learning. You'll assess your capacity for competent, responsible, caring practice. You should be able to contrast 3 approaches to problem solving. You should be able to use the clinical reasoning model or understand how it works. Describe the historic evolution of the nursing process. Describe the nursing process in each of its 5 steps. List the 5 characteristics of the nursing process. List 3 patient benefits and 3 nursing benefits of using the nursing process correctly. Identify personal strengths and weaknesses in light of the nurse's essential knowledge, attitudes, and skills. Describe steps in the concept mapping care planning, and value reflective practice as an aid to self-improvement. So nurses haven't always worked autonomously, okay? Traditionally, they prided themselves on comforting people that were ill, and then taking tasks such as, changing a wound, administering meds, and executing those with precision. Okay, so they learned how to do this, they learned how to bathe and feed, and they learned how to ambulate patients. Physicians would order a lot of the tasks that nurses were doing, and nurses would not have characterized their work as being independent, evidence-based practice or creative. Okay, but throughout the years, the way healthcare has changed and its delivery has changed, nursing's profession has also changed. So now we do a lot of these things autonomously, and we now work with both healthy and ill patients in both long-term and community settings. Okay, in addition to that, we work in specialized roles now as care managers, coordinators, safety and quality officers, teachers, counselors, advocates, and researchers. We're also responsible for a unique portion of healthcare, the diagnosis and treatment of the patient's response to the actual or potential health problem. Okay, so we're looking at that human, that person response to the actual problem that's happening with them or to potential problems that might happen to them. We're knowledgeable and competent and independent professionals. We're able to work collaboratively with other healthcare professionals to not only create but deliver holistic person-centered care. As the role of nurses changed, definitions of nursing have evolved to acknowledge essential features of professional nursing. The ANA says that the professional nurse will provide a caring relationship that facilitates health and healing. The nurse will pay attention to the range of the human experience and response to health and illness within the patient's physical and social environment. The nurse will integrate assessment data with knowledge gained from an appreciation of the patient or group subject experience. The nurse will apply scientific knowledge to the process of the diagnosis and treatment through the use of judgment and critical thinking. The nurse will advance her professional or his professional knowledge through scholarly inquiry. This means doing, peer and literature review and some sort of research to validate what you're doing. Okay, the nurse will make an influence on social and public policy to promote social justice. So you can do this by advocating for patients. You can do this through lobbying, through politics. The nurse will assure safe, quality, and evidence-based practice. So this is something that we as nurses have to consider every time that we provide care for our patients. Okay, we're trying to incorporate these into our practice of care. So the professional nurse wants to incorporate thoughtful practice into her or his practice, and that is being considerate and compassionate. So as a thoughtful nurse, we always keep the person at the center of the caregiving in order to promote humanity, dignity, and well-being of the patient. As a thoughtful nurse, we value our own integrity and our own personal development. We reflect on our practice every day to understand and learn from each day's challenges. And we try to hold a partnership with our patient so that we can deliver care that is holistic and tailored to meet the individual needs of the patient. As a thoughtful nurse, we want to base our care decisions on sound clinical reasoning and judgment. We need to evaluate and review the decisions that we've made through the use of reflective practice so that we can continue to learn from the practice to help benefit our patients of the future. So we have to consider that each person is unique. They have their own set of beliefs and values. Okay, people are holistic. Their emotional, physical, social, and spiritual dimensions, okay, all come together to create this whole individual person. So just because the person has a disease or they're sick, okay, that's only one aspect of the way they're reacting or behaving to what's going on inside the body. So each person's illness or health journey or illness that they go through is going to be individual and personal. We want to create relationships with this person that is therapeutic. Okay, we have to provide respect. We have to value the person, and the relationship for each person is going to be a little bit different or a little bit unique. As the professional nurse, we have to cultivate personal attitudes. We have to be able to master the science of nursing, and we have to use reflective clinical experiences to help develop our own blended competencies. We also need to be conscientious of the QSEN competencies that help promote thoughtful and effective person-centered care. So reflective practice, this happens when the carer or the person that's providing the care has a good awareness of their self. So I have to be extremely aware of myself and my biases, my prejudices, any assumptions I might make. I have to understand how they might affect my relationship with the patient or my therapeutic relationship. And this is done through the process of something called reflection. So we think back on what occurred so that we can learn from it and improve that process. Clinical reasoning, judgment, and decision making. This is the process that we use to analyze a situation, to make a judgment, to determine different alternate solutions or reasons to choose actions that we might want to take. Okay, and it's built on the foundation of knowledge, experience, the personal attributes of the person that's doing the thinking. So if it's you, it would be built on your own personal attributes. And critical thinking is the fundamental process of this clinical reasoning. Care can become ritualistic and depersonalized if we don't use clinical reasoning. Okay, so we just do this repetitive motion with everyone the same way every time, and we don't really put any thought into what we're doing. For the person-centered nursing process, and this describes the way that we care in an organized fashion through actions that we take, okay, in response to the individual needs of each patient. So the components of the nursing process you already know are ADPI, assessing, diagnosing, planning, implementing, and evaluating. And then the nurse's action in response to the individual's clinical need, the healing action that occurs in response to an individual need helps complete the cycle of the thoughtful practice when it's considered personalized, appropriate, valued, and effective. So the components of the thoughtful practice are all interrelated. They function together, okay, to create this thoughtful, person-centered care. Again, the components of the thoughtful-centered person of the thoughtful person-centered practice include reflective practice, so looking back on what we've done, seeing how we can learn and make improvements. Knowing, having full self-awareness about ourselves as the nurse. What are our personal attributes? What is my knowledge base? What kind of clinical experience do I have? I'm bringing my blended competencies in there, the art and the science of nursing, and those quality, safety, and educational network competencies. Okay, the patient, the person is at the center of that care, so they're right in the middle. I'm using my clinical reasoning, my judgment, and my decision-making skills, okay, and then it's patient-centered nursing process of assessing each individual patient, diagnosing that patient, planning and implementing and evaluating for that patient. Guiding principles of person-centered care. So person-centered care came about approximately 30 years ago, as people tried to get nursing back to its holistic roots of healthcare. And the Picker Institute, the Plaintree Membership Network, and most importantly, the Institute of Medicine, okay, brought this report out, and also the introduction of something called HCAHPS, or Hospital Consumer Assessment of Healthcare Providers and Systems Patient Experience Care Survey, also brought about a standardized tool so that we could evaluate, how well we're doing this job of providing this person-centered care. All right, so this survey that I'm talking about is something that hospitals send out to patients, or they have patients fill out, okay, and other facilities as well. All right, so that the patient can describe in a survey what type of care they received, if certain quality markers were met, and things along that nature. And it all talks about, providing the best of care as possible to the person. So these 10 little principles that we want to think about is that all team members are considered caregivers. We are all an equal part in helping to heal the patient. Care is based on a continuous healing relationship. It is customized, and it is designed to reflect the patient's need, the patient's value, and the patient's choices. Okay, if the patient has no value on those choices or on that health care, then they're not going to be compliant. Knowledge and information are freely shared between the patient, the caregiver, the physicians, and other caregivers. So when we're going around in the morning and we're making rounds, we want to include our patient in those rounds and let them have some say, and let them have some decisions, and let them ask questions. All right, care is provided in a healing environment of comfort, peace, and support. Family and friends of the patient are considered an essential part of the care team. The patient's safety is a priority. Transparency is the rule in the care of the patient, meaning that we keep everything open and honest, okay, so that the patient can understand and see what's happening. If they have questions, we answer those questions truthfully. All caregivers cooperate with one another through a common focus on the best interest and personal goals of the patient, and then the patient is the source of control for their care. The International Association of Human Caring believe that caring is the human mode of being, that caring is the essence of nursing, and it is morally imperative that it guides nursing practice, that caring is both spiritual and human consciousness that helps to connect and transform everything in the unit, and that caring in nursing is action and competencies that aim towards the good and welfare of others. Caring is in nursing is a special way of being, knowing, and doing with the goal of protecting, enhancing, and preserving human dignity. Care is culturally diverse and universal, and it helps provide a broad and important means to study. It also helps explain nursing knowledge and nursing care practices. So, some things you can think about is how will this influence you as a nurse and your future practice? If you agree that caring is essential to being human and it is essential to the way nurses promote healing, what are your own personal strengths and growth opportunities to learn how to care better or for caring? How do you plan to focus your attention on human caring as you struggle to master the tasks like safely transferring a patient, assisting with bathing, or administering meds? And how likely are the recipients of your care to describe you as a competent, compassionate, caring nurse? So sometimes you hear people say, hey, not everyone has what it takes to be a professional nurse. And what exactly does that mean? Well, they're looking for certain characteristics, certain personal attributes that you should have, okay? You should be open minded, meaning that you can listen to other people's ideas and thoughts without becoming defensive and you can consider them. You should have a profound sense of the value of the person. Okay? You should have self awareness and be knowledgeable about your own beliefs and values. You should have a sense of responsibility for your actions. At the end of the day, okay, will you take responsibility for the things that you've done? Will you be accountable? You have to be able to motivate yourself to do the best that you can do at all times. Okay? Because other people have entrusted themselves in your care. You have to work on improving your leadership skills to be the best leader, the fairest leader that you can be. You have to be strong. You have to provide your nurses and your staff with the tools that they need in order to perform the work. Okay, so you have to be the best that you can be in order to make them the best that they can be. You have to have a strong knowledge base. Okay? So when I say you have to eat it, you have to drink it, you have to sleep it, you have to poop it, I'm not kidding. You have to have this hard knowledge base. This is where that critical thinking, that judgment is all going to come from. You have this strong knowledge base, you have this experience, and together that's going to help you develop these competent clinical reasoning skills. The knowledge required in giving care interaction depends on the actual clinical situation. So you have to be prepared to deal with it all. All right. The nurse has to be able to understand the disease or the condition, its epidemiology or its cause, its pathophysiology, how it takes hold or moves through the body, What physical and psychological manifestations will it cause the patient to present with? What are the signs and symptoms? And what are the probabilities of its progression or its outcome? So these are the things you have to know about the illnesses that your patients are dealing with. So, for example, let's say your patient came to you and they had a multitude of disabilities. Okay, you have to not only have knowledge about all of that, but also the knowledge to provide resources for when they're discharged home into the local community. Okay, how are they going to get assistance once they leave the hospital? We also have to be able to use these blended competencies. So we try to design and manage each person's care scientifically, holistically, and creatively. And in order to do this, we have to have these cognitive, remember the knowledge, cognitive, the technical, those skills that help you operate the equipment and do things like putting in a catheter and wound care, interpersonal, how you develop that relationship with your patient, and ethical legal competencies, along with the willingness to use them creatively and critically when we work with our patients. This helps us promote or restore health. It helps us prevent disease or illness, and it helps us to help the patient to cope with altered functioning. If we understand the importance of these competencies, then we can conscientiously develop them while we begin to master the nursing process. Cognitive and technical competencies help nurses manage clinical problems that come from the patient's changing health or illness state. Interpersonal and ethical skills are essential for the nurse concerned about the patient's broader well-being. We use this term blended competencies because in most instances, the nurse's actions require all four of those competencies: those cognitive, those technical, those interpersonal, and those ethical skills. So a nurse who sends out to suction a patient has to understand that evidence supports the action. They have to be skilled and able to manipulate the equipment and suction the patient. They have to be able to deal with the psychosocial component and encounter the patient to promote the patient's sense of well-being. And then they have to practice in a manner that's ethically and legally defensible. Okay, so we have to follow the laws of our scope of practice. We have to make sure we're documenting accurately and that we're carrying out manner in a way that's safe and the way that we would expect one to perform it. Few nurses excel naturally in all four of these areas, okay? But as we become more and more experienced, we become more proficient in each one of these areas that allows us to excel. So we have to develop cognitive competencies. These help us become better critical thinkers, okay? So critical thinking, we discussed earlier, is a systematic way to form and shape our thinking. It helps us think purposefully, and it helps us to put an exact process into it. It makes us disciplined or comprehensive thinkers. We use intellectual standards, and as a result, we come up with well-reasoned thoughts. Okay, Alvaro Lefebvre defines critical thinking as not accepting information as at face value. When you critically think, you examine assumptions, you evaluate evidence, and you uncover underlying values and reasonings. The purpose of thinking, we want to critically think about a situation, okay? To discipline our thinking, to direct our thoughts towards a specific goal. And the purpose of critical thinking is to help us make a judgment about a particular patient or a situation or a decision about how we should intervene at this time. Adequate adequacy of knowledge. When you start with this critical thinking process, you have to judge whether the knowledge you have is accurate, complete, factual, timely, and relevant. If you reason with information that is false or that lacks important data, then you won't be able to draw a sound conclusion. So you have to make sure that you understand all the details that are relevant to the issue. Um, Consider what's at stake, how much time will it take for you to make a decision, and is there any room for error? And then you have to learn to look for flags, okay? Because you're going to have problems. Problems are going to come along, okay? And that could be things like working with untested or faulty assumptions, accepting an unproven claim, allowing biases to interfere with your thinking, or thinking illogically, okay? Like making a generalization based on a single experiment, okay? So you can't also allow emotion to rule your reasoning. The more familiar you are with these common blocks to critical thinking, the easier it will be for you to detect them in your own thinking. What kind of helpful resources are available? Okay, so recognize your limits and seek out help. Okay, use experienced clinicians. You can use, research, okay, to help you. And you're going to have challenges that are going to require new knowledge. So you have to be prepared for that. All right. You have to know that you may need help, and you may need other resources to tap into. Okay. Key resources would be other experienced clinicians, textbooks or journals, institutional policies and procedures, or professional groups or writers. Critique of judgment decision. You have to identify alternative judgments or decisions, weigh the merits of each, and reach a conclusion. If you try to predict, sometimes that can help. Okay, what's going to be my consequences? What's going to be my outcome? Because this helps you put the whole clinical process together. And you can even do this when you're answering questions, because it can guide you to the right answer. Okay, if I select this answer, what's going to be the outcome for my patient? Okay, evaluate the alternatives you selected as your decision begins to influence your actions. And then use this method to work through intellectual challenging situations. Critique your method, okay, using clear, precise, specific, accurate thoughts, okay? And think to yourself, have I done everything through the process? Have I thought about this fairly? Have I thought about it deeply? Is the information I've gathered accurately? And then, how is this outcome going to be for this patient? And then we use something called focused critical thinking guide, and this can help, use 5 considerations to facilitate critical thinking. Okay, so especially if you're new at using this process, and that's on page 306 in your book. And then developing the personal attributes to think critically. Reasoning itself has a logical or cognitive or thinking component, okay, and also an emotional or affective component, both of which are affected by the personal attributes of you, the thinker. So it can be affected by your personal beliefs and your values. You have to be an independent thinker and be careful not to allow um, the status quo or a persuasive person to control your thinking. So, you're using this critical thinking and someone else comes in and tries to interject those ideas. Sometimes you have to stick with what your original thought processes are. Don't allow other people to sway you. You will also need to develop technical competencies. Some people are really good with their hands and they can quickly master these procedures, okay, working with different types of equipment. All right, but you will have to learn how to do this. You'll have to develop interpersonal competencies, learn how to promote human dignity and respect, establish caring relationships, and be able to enjoy the rewards of that mutual exchange with the patient. Sometimes your presence, just the way you present yourself, the way you enter a room, the way you communicate, okay, you're able to promote this human dignity and respect. Remember that the more vulnerable the patient is, the more threatened that you can make the patient feel, depending on your presence and how you interact with that patient. Establishing caring relationships, okay, you have to think about what is the priority of nursing care, okay? I know there's a lot to do on the floor, and I know we're busy running here, there, and everywhere, but we do have to try to still, send that message to our patients that we care about them, and we still have to try to engage in that therapeutic relationship. So, we try to conversate, communicate, um, we try to establish a conversation so that we can communicate and talk to our patient. And we want to understand, what the patient's experiencing and what they're feeling. And we're not just chatting about, this, that, or the other thing, the weather or the baseball game or whatever. We're trying to develop this caring relationship of how this is affecting the patient and their life and how they're going to handle some things when they go home or when they're not around us anymore. As far as enjoying the rewards of the mutual exchange, when a patient is provided care in a way that makes a difference, okay, and it affects his or her well being, their gratitude, even when unspoken, will help renew your energy as a nurse. And then we have to, develop these ethical and legal competencies. Okay, so um, we want to be sensitive to the ethical and legal implications of the nursing practice. Okay, in chapter 6 and 7, we'll talk about different components of ethical and legal competencies for nurses. It can take years to master effective patient advocacy skills and become proficient um, in mediating ethical conflict. Okay, but you are responsible for certain basic ethical skills. When you're committed to interpersonal caring, you hold yourself accountable for the human well-being of the patient that is entrusting themselves in your care. And being accountable means that you're attentive and responsible to the healthcare needs of each individual patient, and that your concern for the patient transcends whenever you're encountering that patient during your shift, and that you ensure continuity of care when you leave a patient. Being responsive and responsible earns a patient's trust that all will be well as healthcare needs are addressed. Nurses committed to responsible care reflect on the following. They reflect on their commitment, okay, to the well-being of the human or the person in their care. They're comfortable, okay? They're comfortable with voicing patient needs that are not met and advocating for those patients to members of the healthcare team. They're comfortable with making sure that the patient's needs are important to them and that they're an effective advocate. Those caregivers listen. They listen to what the patient's saying, okay? And they're conscientious, okay, of what's going on the floor, what's going on around them at all times. And they're conscientious of ways that they must personally change in order to make a better experience for their patient. Nurses that are sensitive to legal dimensions are careful to develop strong senses of both ethical and legal accountability. Competence practice is a nurse's best legal safeguard. Nurses seeking to develop legal competency find it helpful to ask themselves, do I know the legal boundaries of my practice? Have I read my State Nurse Practice Act? Am I familiar with my institutional policies and procedures? Do I own my personal strengths and weaknesses and ask for help when I need it? Am I careful not to accept the responsibility for an assignment for which I am not prepared? Am I knowledgeable about the respect and patient's rights? Does my documentation provide a legally defensible account of my practice? Interesting question there. All right, so your documentation has to support all that. You have to recognize that both deficiencies and excesses of responsible caring are problems. It's also reasonable to hold yourself accountable to promote the well-being of your patient. You can make errors by setting unrealistic standards of responsibility and responsiveness for yourself. Prudence is always necessary to balance responsible self-care with the care of others. An inexperienced nurse may feel totally responsible for the patient outcomes, even those that are beyond their control, and may be frustrated and sad when they're not able to produce the desired outcome. Talk to other nurses and determine what is reasonable to hold ourselves and others accountable for. Now, we talked a lot about QSEN competencies, okay? And this is quality and safety education for nurses. And the purpose of this is to prepare future nurses to ensure that they have the knowledge, the skills, and the attitudes that they need to continuously improve the quality and safety of healthcare in the system that they work in. A nurse's personal moral code is to assist all patients to the best of one's ability. What blended skill would the nurse use when seeking out special services for a homeless patient with a diabetic foot ulcer? And the answer is ethical legal. Using ethical legal skills is the best answer as it involves a moral code and acting professionally. Cognitive skills involve thinking through a situation. Technical skills relate to proper use of equipment, and interpersonal skills are used to develop a caring relationship. Okay, QSEN competencies. So, patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. So for QSEN, okay, listening to the patient, demonstrating respect and compassion incorporates this patient-centered care. All right, the QSCN competency emphasizes and stresses that we recognize the patient as the source of control and as a full partner in providing compassionate and coordinated care based on a respect for patient preferences, values, and needs. That we use teamwork and collaboration. Now, traditionally, teamwork may involve working side by side with other healthcare professionals while performing different nursing skills. The updated QSEN definition calls for functioning effectively within nursing and interprofessional teams, fostering open communication, mutual respect, and shared decision making to achieve quality patient care. Evidence-based practice, okay? Adhering to internal policies and standardized skills, QSEN specifies integrating the best current evidence with clinical expertise and family and patient preferences and values for delivery of optimal health care. And quality improvement, okay? A long-standing approach to quality improves routinely updating nursing policies and procedures. A long-standing approach to quality involves routinely updating our nursing policies and procedures. With QSEN, they recommend that we use data to monitor the outcome of care processes and use of improvement methods to design and test changes to continuously improve the quality and safety of healthcare. And then safety, okay? A tradition of safety is to use bed rails properly to ensure that the patient doesn't fall during my shift. The QSEN assures recognition of a culture of safety and minimization of risk of harm to patients through both system effectiveness and individual performance. And informatics, traditionally documentation was timely and accurate charting, but with QSEN, it's now expanded to include calls for using information and technology to communicate, manage knowledge, mitigate errors, and support decision making. People use critical thinking skills when they want to use clear, focused thinking to achieve different results. And so, you want to use this critical thinking in your nursing practice, and you want to use clinical reasoning and judgment. So in the nursing process, we use problem solving, and clinical reasoning helps us do that. Okay, problem solving is a basic life skill. We have to identify a problem, and then we take certain steps to try to resolve it. Okay, and generally those steps are a matter of common sense. But we can use different approaches to problem solving. Some are more successful than others. Okay, so trial and error. This is testing any number of solutions until one is found that will work. But it's not efficient for the nurse, and it can be dangerous to the patient. So it's not recommended as a guide for nursing practice. An example of this would be experimenting with different types of ethnic foods as you learn to discover which ones you like or don't like. Scientific problem solving is a systematic 7-step solving process. It involves the problem identification, data collection, hypothesis formulation, a plan of action, hypothesis testing, interpretation of results, and evaluation, which result in a conclusion or a revision of the hypothesis. This method is used more commonly in a laboratory setting, a controlled laboratory setting. Okay. Um, the nursing process is an example of the problem solving process, the scientific problem solving process. Intuitive problem solving has been used by nurse therapists and educators throughout the years, but they've argued that clinical judgments should be based on data, logic, science, evidence-based method. Okay, this helps establish nursing as a science and allows other professions to respect it as one. Many veteran nurses can describe situations in which an inner prompting or an intuition led them to a quick nursing intervention that saves someone's life. So when the nurse is directly approaches a situation based on its similarity to or dissimilarity to other situations, they use this intuitive problem solving. Intuitive problem solving itself is a direct understanding of a situation based on a background of experience, knowledge, or a skill that makes expert decision making possible. Okay, an example of this would be a recovery room nurse who realizes that a post-op patient is changing in status. So their status is starting to go down or deteriorate before they're able to check the vital signs to suggest that trouble is happening. They use intuitive problem solving. If you're just a starting nurse or a new nurse, you have to use knowledge and scientific problem solving, okay? Because intuitive problem solving comes with years of practice and observation. So, critical thinking, intuitive, logical, or both, okay? So, clinical reasoning that is logical, scientific, and evidence-based promotes clinical reasoning that is creative and intuitive. So realistically, we have to use all these, okay? Because if intuition is used alone, there are increased risk and less benefits, okay? So we might use intuitive thinking, okay? Because logical thinking sometimes blocks or constrains ideas. So when we're doing things, though, like developing policies and procedures, then we have to use more of a logical and evidence-based approach. All right. So sometimes we have to think out of the box. Sometimes we have to use logic and reasoning. Logic is the safest approach, but it doesn't help us to create out of the box ideas. Okay. And sometimes it can inhibit the way we think. So we want to be able to use both logic and intuition. All right. To bring a better result. Critical thinking and clinical reasoning involve reflection and creative thinking, imagination, intuition, spontaneity. Okay, so we're thinking outside the box. We're thinking about alternative perspectives. Decision making and clinical reasoning. We do this every day. We decide what to eat, where to work, whether or not to exercise. So we do this already. Okay. We think about the different options and what are we going to do. Now, what are some decision-making errors that we might have? Well, one is bias, placing emphasis, okay, on the first data that we receive and not considering other data that comes in, okay, avoiding information that is contrary to our opinion. So something comes in, but I don't like it because it doesn't match my opinion, so I'm not going to use it. Like Trump. Seeking alternatives to maintain status quo. So, what are some options that might make me go with the flow instead of thinking outside of the box? So I want to avoid that status quo. Remember, we talked about that earlier. Being predisposed to a single solution or stating the problem in a way to support one's choices. Making decisions to support past choices. Also, we fail to consider the total situation. So we only look at one aspect of the problem, okay? We have to treat the problem in whole. When we do this, we use inaccurate data. Sometimes we don't clearly identify the problem. Sometimes we use unrealistic goals. We become impatient, okay? And then this causes us to fail to identify other possible solutions. It causes us to incorrectly implement decision making, and it causes us to fail to use appropriate resources. All right, development of the nursing process. So towards the second half of the 20th century, we started to study the process of nursing so that we could understand and improve the way that we accomplish our aims. Hall used the first term of nursing process in 1955, and a lot of nurses struggled to define exactly what constitutes the work of nursing or what makes nurses successful. In the 1960s, the steps of the nursing process were delineated. They were assessment, planning, intervention, and evaluation. In 1967, Ura and Walsh published the first comprehensive book on the nursing process. And then later, we developed this 5-step nursing process by adding diagnosis as a separate step in the process. So now we have the 5-step nursing process that is commonly used today, described as assessment, diagnosis, outcome identification, planning, implementation, and evaluation. In 1973, the ANA, American Nursing Association Congress for Nursing Practice, developed the Nursing Standards of Practice. The standards have been revised multiple times since, okay? In 1982, the State Board Examinations for Professional Nursing began to use nursing process as a way to organize the concepts. So the nursing process itself is a systematic method that helps direct the nurse and the patient's participation to accomplish assessment of the patient to determine a need for nursing care, to determine a nursing diagnosis for actual and potential health problems, to identify expected outcomes and plan care, to implement the care, and to evaluate the results. The steps in this person-centered, outcome-oriented process are all related. Okay, each step depends on the accuracy of the steps preceding it. The process provides a framework that allows the nurse and the patient to accomplish a systematic way of collecting data, a way to clearly identify patient strengths, as well as the actual and potential problem. That's our diagnosis. Develop a holistic plan, an individualized plan of care that specifies the patient's goals and outcomes and the nursing interventions that will be likely to implement that will help that patient meet those expected outcomes and goals. So when I tell you that things have to marry one another on the care plan, this is why. Evaluate the care plan. Execute the care plan by implementing it. Okay. And then evaluate the effectiveness of the care plan, okay, in terms of patient goal achievement. So we evaluate where the goals met or unmet. So we assess through collecting, validating, and communicating patient data. Then we diagnose. We're looking at those actual or potential problems. So we're analyzing that patient data to identify strengths, weaknesses, and actual or potential problems. We plan, okay? So we determine what we want our patient outcomes to be and what nursing interventions will help us achieve those outcomes. Then we implement. We carry out the plan, okay? We put it into place. And then we evaluate. We measure if our patient was able to meet those goals or those outcomes that we have together, okay, put into the care plan for this patient. Which step of the nursing process is a nurse using when analyzing patient data to determine if a patient's strengths, following a CVA or a stroke? Okay, hopefully you said diagnosing. This step involves analyzing patient data to determine strengths and weaknesses. And the assessment step refers to collection, validation, and communication of patient data. In the planning step, we determine patient outcomes and the related nursing interventions. And in the implementation step, we carry out the plan. When we evaluate, we measure the extent to which the patient achieved their outcomes or their goals. So this again just talks about the steps of the nursing process and how they overlap one another, they're dynamic, and they're interrelated. Which of the following characteristics of the nursing process describes the interaction and overlapping of the steps within the process itself? A dynamic. The nursing process is dynamic in that there is much interaction and overlapping of the steps. It's systematic because it's an ordered sequence of activities. What are the characteristics of the nursing process? So the main words that have been used to describe the nursing process are it's systematic, dynamic, interpersonal, outcome-oriented, and universally applicable. Okay, as far as systematic, okay, it's part of an ordered sequence of activities. So each activity depends on the accuracy of the activity that occurs before it, and it influences the actions of the activity that follows it. Without a complete and accurate database, the nurse cannot identify patient strengths and problems. Lacking knowledge of these, the nurse and patient cannot develop a care plan based on realistic and valued patient goals. So the goals and outcomes must be well written. Nursing actions and evaluation that lack focus may not be effective. The nursing process will direct each step of nursing care in a sequential, ordered manner. It's dynamic, okay? The nursing process comes as an orderly progression of steps, but there is interaction and overlapping between each step. So no single step in the nursing process is a one-time occurrence, okay? Each step flows into the next step. And in some situations, all 5 stages may occur almost simultaneously. Interpersonal, okay? The human being, most important, okay? The nursing process ensures that nurses are person-centered, not task-centered. So, approaching a patient to take vital signs, the nurse might ask, how are you today? Are we helping you achieve your goals? What are the most important things you would like to do? Okay? So, you're talking to the patient and you're talking to them about their values and their preferences. We encourage nurses to help patients use their strengths and meet their human needs by using the nursing process. Okay? It's different from viewing the patient as a problem to be solved. Okay? We work intimately with the patient to explore their own strengths and limitations and help themselves develop personally and professionally. The nursing process is outcome oriented. Okay, this means it offers a way for nurses and patients to work together to identify specific outcomes that are related to not only health promotion, but disease and illness prevention, health restoration, and coping with that altered level of functioning. We determine outcomes that are most important to the patient and match them up with the appropriate nursing action. When the outcome is recorded in the care plan and prioritized, then the nurse can quickly determine the patient's priorities and begin nursing with a clear sense of how to proceed. What direction am I going to go in for my patient? The nurse benefits from the continuity of care. The patient benefits from the continuity of care and each nurse's care moves the patient closer to achieving this outcome. And then universally applicable, okay? The constant in healthcare is change, okay? That is always going to happen in healthcare, so get used to it. Don't be resistant to it, okay? If nurses have a knowledge of the nursing process and they understand that they can practice with well or sick people, young or old, in any practice setting, then you understand that by mastering this nursing process, you will have this valuable tool that you could use in any nursing situation, okay? It gives us a framework for all nursing activity. In each nurse-patient interaction is important, so we have to assess the patient, note significant changes in the status, determine if the nursing action is helping that patient achieve their goals, and modify that care plan as necessary. Depending on the results, a new nursing diagnosis may be needed, along with related additions to the care plan. The nursing process can direct all activities carried out by the nurse when caring for a patient. If it's used right, the nursing process achieves scientifically holistic, individualized care for the patient. Okay, the opportunity to work collaboratively with nurses and provide continuity of care. When we use the nursing process in a thoughtful and systematic way, we achieve clear, efficient, cost-effective plans of action, and we use the entire nursing team can achieve the best results for the patient. The satisfaction that we are making important differences in the lives of our patients, and by allowing us an opportunity to grow professionally as we evaluate the effectiveness of the interventions and the variables that contribute positively or negative to the patient's achievement, should help us understand and guide us to want to use these tools. So we benefit, the patient is benefited because they get this scientific based, holistic, individualized care. They get continuity of care, and we're able to provide a clear, efficient, cost effective plan of action. The nurse gets the opportunity to work collaboratively with others. She gets satisfaction out of knowing she made a difference in her patients' lives, and it provides her or him with an opportunity to grow professionally. Okay, concept mapping. This is a strategy in where the learners identify and graphically display either in a diagram or a drawing. They're able to identify interrelationships between different concepts. They are also called cognitive maps, mind maps, or metacognitive tools for learning. Okay, because they promote critical thinking and self-directed learning. Concept maps. They allow a visual picture of the internal processes nurses use in the critical thinking and relationship analysis. Schmel articulates that concept mapping, as it is used in nursing, serves as a pathway to the intersection of critical thinking and theory to practice application. So it helps us guide that theory and merge it with the application of our practice. Concept maps help student nurses to design a care plan based on the individual patient concerns and problems. Using a concept map promotes critical thinking and the ability to recognize relationships and connections between data and the ability to apply that knowledge to patient care. There are several sources that discuss different ways to approach concept mapping. You can use boxes to cluster, organize, and link information. You can use a framework of the concept map to provide meaningful learning for nursing students, teaching them how to link new concepts to known concepts and build new knowledge. So according to Schmel, the basic steps in concept mapping are as follows. Collect patient problems and concerns on a list. Okay, the list can include a symptom, lab value, diagnostic, test results, treatments, or collaborative care concerns. The data obtained from the assessment, from the patient, directly from the medical record, and from interactions with the interprofessional team. We're going to connect and analyze the relationships, differentiate between the groupings of main and related problems, and we're going to question, compare, contrast, and group the data. We're going to create a diagram to demonstrate the problem recognition, critical thinking, and nursing actions. We can use shapes, connecting links, descriptive phrases, and learning styles to emphasize nursing actions as it relates to the care plan. As the concept map becomes more complex, you can use a key with the diagram to keep track of what each box, link, shape, or color represents. Keep in mind that creativity is encouraged and no two maps should look the same. Keep in mind key concepts: the nursing process, holism, safety, and advocacy. Is the following statement true or false? Concept mapping is an instructional strategy that requires learners to identify, graphically display, and link concepts. Okay, if you said true, you were correct. Concept mapping is an instructional strategy that requires learners to identify, graphically display, and link key concepts. Reflective practice. Okay, reflection is normal. We frequently think about what just happened, how it affected us. Okay. Reflective practice is a purposeful activity that leads to an action or an improvement of practice to better patient outcomes. It's about looking at the event, understanding it, and learning from it. We learn from reflection, okay, but it's not automatic. We have to understand why and how the reflection contributes to the competency of the effective nurse. Sean listed 3 types of reflection. Reflection in action. It happens in the here and now of the activity, and it is also known as thinking on your feet. Reflection on action, which occurs after the fact and involves thinking through a situation that has occurred in the past. It uses a means of evaluating the experience to decide what could have been done differently. And then reflection for action is the desired outcome of the first 2 types of reflection. Okay, it helps the person think about future actions that might change as a result of the reflection.